Okay, Mike Masato, CEO of Staff Driven Dental and the Dental Road Warrior, returning for episode 96 in this series. So a subject I want to cover today is about health. And I want to make an analogy of health, your health, and the health of your practice. And I brought this subject up at a recent seminar I just completed last week for my clients, but it bears repeating. As we're coming out of COVID-19 and we're starting to get back to normal, hopefully in the next several months, everybody getting vaccinated or whatever you're doing out there to get back to normal as restrictions are lifted and we're getting back to normalcy in practice. It's easy to forget how we got here in the first place. But I want to use a correlation as regards to your practice. If you want to know the number one reason why your practice is sick and unhealthy, why do you think that is? Right? It's a responsibility problem. See, we've given responsibility of the health of our practice. We've put it in the hands of two factors: insurance companies and pharmaceuticals. Because basically our entire healthcare system revolves around these two entities: healthcare, insurance companies, and pharmaceuticals. And unfortunately, it's failing us. Because if you look at your revenue, in most cases, if all your revenue is tied to what a pharmaceutical-based healthcare system allows you, or an insurance-based healthcare system allows you, you're in trouble. Because these entities did not come into existence first and foremost for the overall health and well-being of society, or take care of you and make sure you do well in practice in your business and make sure everybody's healthy and well. They came into existence to make money, and that's what they do. And unfortunately, that's the whole reason they exist. And as a result of that, your health, the health of your patients come second or worse. And that's why we struggle, because we are limited in terms of how healthy we're going to be and successful we're going to be when we have to put the hands of all of our health same thing we have to do with our patients. Isn't it frustrating that we put the hands of our patients now has to go through some third-party entity to give some approval based on recommendations you have for patients' health, that when you know best and you have some people out there looking at what you're sending them, if they even look at it, to make determinations on what is needed for care or not. It's really an insane system that we live in, and we wonder why we struggle, right? So that's why I always teach and we always coach is to take more financial responsibility of your practice by going about your business in a different way. Being more causative about generating your own revenue, whether it's through cash plans or fee-for-service dentistry, or not getting involved with insurance companies that are going to make you cut your fees to ridiculous amounts, like these HMOs and DMOs, and getting on those kind of plans, or PBOs that pay a half of your fee when you're lucky, and all these different stipulations and whatever. This is a route to disaster as we go along like that. And it's like we get less and less every year, and these companies don't get any better. It doesn't get better every year. It gets worse, unfortunately, right? So I always teach about, like, you have this business, you're responsible for it, and if you put it in the hands of third parties or other people to be successful, you're in big trouble, right? Whether you pursue like passive marketing, I'm just going to throw money at this. I'm going to throw money at marketing, or throw money over here. Right? You need to be engaged and take responsibility over the health of your practice, because that's solely up to you, right? And when you put it in the hands of other entities, other people, it's not going to work out real well for you. And that's why we spend a lot of time coaching our practices of better ways to invest and spend their money on their practice, and taking more control and being more aware of what's going on with the health of their practice all the time, because we don't tend to look at this kind of thing. We tend to take it for granted. We assume it's going to be all okay, and it runs on autopilot, and whatever I get, I'm doing my thing, and that's it, right? And that's where we get ourselves in trouble. Well, guess what? The same is also true with your own personal health, right? And as healthcare providers, we need to start doing a better job coming out of COVID, or just maybe it's a wake-up call, to start practicing what we preach. I've said this 25 years ago when I started doing this in dentistry. One of the most difficult conversations I had to have was with dentists to say, you know what, you're preaching dentistry and healthy teeth and healthy gums, and you are the worst example of that. How can that possibly be? It's hypocritical when you don't spend time in your own chair or someone else's, a chair of your colleagues, to make sure you have optimal oral health. So how are you preaching and selling optimal oral health if you are not an example of that? Or if it's cosmetics, having a healthy looking smile, beautiful smile, if you're going to do cosmetics and present that. Same goes for your team. I don't want to treat them because they may leave me. Well, you know what? Do a better job of bringing people in that won't leave you right away. But if they're going to be there representing you, perhaps you should invest some money in them and time in them to take care of them as well. So they represent your dentistry and what you're doing very well. I mean, you don't have to agree with this. I'm just telling you what I've learned from experience and what I see out there, because you need to be the example and take responsibility for setting that example to your patients for health. But it starts with you practicing a policy of extreme self-care with yourself. See, the thing is right now, we're doing it again. We have a vaccine, we're all saved. It's all going to be fine. We're going to put the long-term health and well-being of society, of ourselves, in the hands of a magic pill or a magic drug, right? I'm not saying you shouldn't get it. That's up to you. That's a personal decision everybody's got to make. Right? What I will tell you is you need to be aware and responsible that it's not the be all and all of everything. Everybody listening to this video right now has a thing called an immune system. And an optimally functioning body and immune system is very difficult for that person to get sick, because a healthy body doing what it's supposed to do, just like in dentistry, if your mouth is healthy and you're maintaining its health and it's functioning at optimal level, you're not going to have the teeth falling out of your head. You're not going to need advanced intervention, on dental intervention, to replace teeth and do all these different things. You're not going to need that, because your body in its normal state, right? You have to ask yourself, are we all born sick and then we get healthy, or are we all born healthy and inherently healthy and then get sick as years go on? It's the latter, what I just said. We're all born inherently healthy, barring, of course, any genetic, situations that are truly, that set us back from the beginning, and that's unfortunate in those particular circumstances. But if we're all born, without any genetic problems or whatever, we are healthy. We start off with that, and then gradually it's this problem where our health goes down this downward spiral. Well, as we get older, it takes a toll. It doesn't have to be that way, but there's things like stress. 80% of all illness can be traced back to stress and how much stress there is in our life, and that does affect our body. Physical, chemical, emotional stress wears down our health over time. But there's also the neglect of, we don't exercise, we don't sleep right, we don't eat right. Do you realize how much nutrition and diet have to do with health? Yet the average medical doctor has 0 to 4 hours of training in nutrition. Just comprehend that for a second. That the average medical doctor has virtually no training on nutrition. They'll say, go to a dietitian or go to a nutritionist and do that. Yet you are what you eat. It does apply. So if you are, and again, what are we seeing with COVID? When it hit, a pandemic comes along, a virus, right? And what happens? The weak, sick people, the unhealthy people, first and foremost, are the ones that are affected the worst. And that's where we see the highest casualty levels. Most of the people that were unfortunate that we lost, of our friends and family, had compromised immune systems. They had pre-existing conditions. They had other diseases that they were dealing with. And you know what? Obesity is a disease, right? That is part of a major problem in America right now, right? That is a problem. That affects our body, right? There are many. If they have heart disease, they have other pre-existing conditions that are going on with their body, and this thing comes along, right? And they have a compromised immune system to start off. We have no ability to fight this kind of stuff off, right? I mean, look at the sample. We have a flu shot forever. We get a flu shot every single year. Tens of thousands, millions of Americans get a flu shot, and now we find out, well, it's only effective up to a certain amount of people because the flu mutates and whatever. Yeah, that's what's going to happen with COVID. It's already mutated, and we're going to have COVID season. You're going to see that in the future as well too, right? And yet, still, people that get the flu shot, still people that are having the flu shot, right? We still have deaths. We have upwards of 50 to 60,000 deaths probably in a bad flu season. But those are now acceptable losses in society, which is unfortunate. We just take that for granted. That's just the way it's going to be. And guess what? Since the flu is not a required reportable disease, right? It's probably 10 times that every year. But you'll never hear about it because it's not in the news. It's not whatever. All right. So, but again, just because you put something in your body doesn't mean it's going to be healthy. Health comes from within. The health of your practice comes from within. It's taking responsibility for your practice, taking responsibility for your health, and you will more than likely be healthy. And sometimes you need some coaching on this, because guess what? We don't know where to go to get this information. You can't go to your medical doctor and walk into your medical doctor one day, your primary care physician, and say, "Hey doc, I made an appointment with you," because they're going to ask you what's wrong. And he said, "No, I'm 100% healthy, but I want to stay that way." He'll look at you like you have two heads and laugh you out of the office. Because we do not have a healthcare system in this country. We have a disease care system. Who goes to the doctor when they're healthy? We go there when it's already too late, when we have a disease, and we're like, "Oh, please save me. Give me some intervention." Just like what happened now with COVID. Please save us all. We are diseased and unhealthy in the first place, and now we're getting hit with COVID, and it's deadly, right? It would be far less if we did things like prevention and wellness, right? Again, this is what I'm talking about here, is a wake-up call. Because you know what? Something else is going to come along someday. And if we are in an optimal, healthy state with our practice, our healthy ourselves with ourselves, less than likely that something like this is going to really be detrimental to us, right? So remember, right, you can put anything in, right, but it all comes from the inside out in terms of health. And you know what? And without an optimally functioning body and immune system, you're not going to stay healthy, right? And I've been coaching people on health forever, way before even got into dentistry. And I try to be an example of that in how I take care of myself. I couldn't do what I do and have the energy that I have if I didn't take care of myself optimally. And I'm not saying I'm perfect. And it affects me too. I've had my bouts and challenges, you know what? But I'm able to rebound and get healthy and respond. And if I do need to take a medication or have an intervention, it works phenomenally well with me because I don't live on them. I don't depend on them for my health, right? It's an adjunct as a last resort. And that's what we need to look at right now. These things should be a last resort approach. You're going to do a lot better off if you take more responsibility, again, for your own health, the health of your practice, rather than say, "Hey, let me see responsibility over to things like insurance companies and pharmaceuticals and whatever." Because, again, as much as they can be helpful and needed in certain times and for certain groups of people, they shouldn't be the be-all, end-all of everything. And if you want to look at the statistics of how well things are going out there, we have a healthcare system that's failing us. And I use these statistics all the time when I speak. We are of all industrialized nations in the world, we are dead last on the World Health Index. We have more hospitals, more people in them than the rest of the world put together. We consume 70% of the planet's drugs in this country, yet we have 6% of the world's population. Just comprehend that for a second. You'd think with all these medications and all these drugs and over-the-counter stuff, the average American, 27 drugs in the medicine cabinet. I can go on and on. I don't mean just prescriptions. I mean it's over-the-counter stuff. You'd think we'd all be healthy. But the fact of the matter is, statistically across the board, as great as this nation is, we are the sickest of all, right? So something's not working right there, and as a result, the problem starts with all of us not taking more responsibility for our own health and well-being, and becoming informed and knowing that no matter what you put into your body, whatever you eat, whatever you drink, if it's a shot, if it's a pill, everything you put into your body has an effect on your body, for better or for worse. There's not a drug out there, and anybody listening to this with their doctors knows, that doesn't have a side effect. Nothing is 100% safe. Anybody tells you that all this stuff you're putting in your body is 100% safe is living a lie. Because everything has consequences on your body. It just does. You need to become informed. You need to make the best decisions about your health. Don't just blindly go, "I'm going to do whatever." Right? Make these decisions just like you wouldn't blindly take advice about your practice, about doing things like this. Don't take my word for everything I'm saying. If you don't believe me, go research it for yourself. I've been speaking on this. I used to speak on healthcare for many, many years prior to doing what I do right now. Right? And I'm really concerned because, as I said before, I see this, we're going to get complacent and lax again. And history will repeat itself. Don't let that happen with your practice. Many of you are putting fail-safes in place. So again, if we're ever hit with some kind of thing like this, we're prepared so our practice doesn't go under. And financially, I want to be more stable and secure. Right? The same thing goes with our own personal health. Because I'm a big believer that everything revolves around you, doc. If you're a doctor watching this whole thing, you are at the core of what, if it all goes right or doesn't go right in your practice. And if you're not in an optimally functioning state, as I said, physically, emotionally, mentally, right, you're going to have issues, right? So please take these words to heart, right? And again, this is not a political statement. It's not I'm not paid to say these things for any particular reason. I'm saying this all to you because I care, and I see it time and time again. And when a doctor is healthy and happy and functioning, things go well. and when it's to get reversed, it's not. Ask yourself how effective you can be when you're not. How can you be effective as a healer and taking care of people if you're not healthy yourself? If your dentistry is not in peak condition itself, right? All of this plays a part. So like I said, take these words to heart. Hope this is helpful. Hopefully a little reality check. That's what I try to do and enlighten people when I do these things, not just give you dental practice management coaching advice. I'm trying to give you some life coaching advice that's worked for me, and hope it works for you too as well. All right, thanks for watching this video. A little long one today, probably my longest one in history of the Dental Road Warrior. As we're closing in on episode 100, we'll have to do a special one for that. Maybe I'll do 100 minutes of my 100th episode. So, but anyway, again, thanks for listening. If you're enjoying these videos, please leave a comment, please leave a review, share them with other people, and I'll be back soon with another episode.